And so there are some recommendations on how to prepare for your doctor's visit, especially if you're going like an annual visit, where, a lot of might have happened during that year. You might have changed medications, you might have had a fall, you might have been in the hospital, and usually, at least my doctor always asks, have you been hospitalized? I think that's part of standardized questions from your doctor. Have you been to the hospital? Have you changed any of your medications? So make sure that you have all your medications, listed, written down. So I have this little handout here, and get past that, about some of the things that you might want to ask your doctor about your osteoporosis. So some of the things that they want you to do when you're, going to get ready for a doctor's visit is to be prepared with a list of your concerns. What has been bothering you? Are you, worry about your bones? Is it getting better? Am I taking the right amount of calcium or vitamin D? So you want to have those concerns listed, because, as I said, you get there and the doctors have 10 minutes? At the most, 5 minutes, 10 minutes with you, and then they leave. So you want to use the time as good as possible, so you get all your answers done. So a list of your priorities and concerns, and write them down. That's that little list here. I think is a good one. It gives you an idea on what kind of questions to ask your doctor, about your osteoporosis. So you write them down, and it just makes it easier for you. Another thing that they recommend is that you bring somebody with you, if it's at all possible when you go to see the doctor. Because, 4 ears and 4 eyes are better than 2.
Right.
And you leave the doctor's office and you say, what did he say? I forgot what he told me about this, that, or the other.
Like when you're pregnant, you write all the questions down because when you get there, you forget what they are.
Right.
That's true.
So that is helpful to have somebody with you if it's possible, and have that person, write the answers maybe, for you while you're talking to the doctor. So it's a good thing. Also, make sure that you can see and hear well. So don't forget your hearing aids if you have hearing aids, or your glasses when you go to the doctor. So you're some other time we're going to talk about how important it is of your vision and your hearing as for your balance and to prevent falls. Okay. So that's important that you're hearing what the doctor is saying. And then plan to update the doctor on what is happening to you since your last visit. So, it's just a good idea to write down, day before, some of the questions that you might have for your doctor. I myself, I can tell you, I've developed in the last year arthritis, which kind of came out of the blue. I don't, I've always had good knees, good bones, my back was okay. I worked 50 years and I never had a back problem. And all of a sudden this thing is creeping on me. So I went to my rheumatologist because my knee swelled, and I have Lyme, and this happened about 20 years ago, and my other knee really was huge, and they had to take the fluid out, and they tested me for Lyme, and I was positive. So I was concerned that this was Lyme on this knee. This is just recent. So he took fluid out and went to the lab, took the blood samples and all that to the lab. And your Lyme test, if it's an all Lyme, it'll come out positive, and it'll come out. And forever it will come out positive. But how do you know if it's not a new case? You know, and I pretty much knew it wasn't because I haven't been out in the woods like I was at home. You know, had a lot of woods in the back and deers crossing all the time. So, so I learned that the fluid that they took out was negative for Lyme. So I said, what's causing all this then? Why is this inflammation and all that? And he said to me, oh, it's just old age arthritis. All right. I don't want to accept that just as quickly as that. I mean, how do you know how bad my knee is? If I have arthritis, I know it cracks now, and then I know it's you know, I cannot kneel like I did before. I have to be careful. And so, you know, I kind of pushed a little bit for either an X-ray or something, you know, that I can know what's the status. At least since this is just starting, I want to have a baseline. So, so he agreed, and then my back has been really bothering me. So I had to kind of push him to get an X-ray on my back, which I'm going to go and get today, just as a baseline, you know, just to see what, you know, it's got to be on my back, because he did X-rays on my low back when I came in with my knee problems, because I told him about my back pain. So that came out that I had arthritis of my spine. In fact, I had severe arthritis of my facets, which is a joint from one vertebrae to the other, where the joint is called a facet, and there's a cartilage there. So that's what's causing. So unless you really ask the questions and push a little bit, you know, don't be afraid to ask them again. So why is that? You know, what is causing this?
What's the difference between a rheumatologist and orthopedic? Who you said your knee. I mean, I would automatically go to an orthopedic guy, but why a rheumatologist?
Because I see a rheumatologist, and I've
Is that
had
the
the same
only reason?
rheumatologist for yeah. I would go to the orthopedic if I'm going to need surgery.
No, I
At
mean,
that point,
what
but
do you have checked then?
Yeah, you can go to an orthopedic, you know. But since I know I have Lyme, I wanted to know whether it was Lyme or not, and that's my orthopedic.
So there's no difference, real? I mean, there is a difference, but not to diagnose with your bones and stuff like that?
The rheumatologist can do that, you know. The rheumatologist can diagnose your arthritis. I mean, that's their specialty, okay? Their joints and bones, you know. So, you know, you can, if you don't have any other conditions like I have with the Lyme, I would have gone to an orthopedic doctor, and he would have treated me. And eventually, I might go to an orthopedic doctor, you know, if my knee. Now, this doctor that I go to, they do all the injections to the knee, you know, the gels and all that stuff. So they know how to treat, you know, arthritis.
What was swelling? What was swelling?
Inflammation, you know, this is just, that's my question. Why is it so swollen? That's why I thought it was Lyme. That's why I came to see you, because, you know, he knows me from before. So, she said it's inflammation. You get arthritis, it comes and goes. You know, that's typical
So this was
arthritis.
the bone that was swelling?
No, no, the bone cannot swell, but it's,
Okay,
it's
so I'm
all,
saying, the cartilage around it or the
no,
ligaments?
no, the cartilage cannot swell either. It's just your body's, you know, immune system reacts to something that is
Isn't it
going on.
inflammation? So
Inflammation.
inflammation happens due to various things.
Various things.
And even
That's why I was wondering,
the-
what was getting inflamed, is really what I'm.
Yeah,
trying to
well,
make sure.
that's, I think,
All the tissues around the joint, you
Yeah.
know, all this synovial fluid that is in the joints, they bathe the joint. As you get arthritis, the synovial fluid, because it gets to get less and less and less. Your joints begin to dry out, okay? They begin to dry out, and then the cartilage, it's a tissue that that it's in between two bones, you know, and it's like a shock absorber, and it begins to, as you get arthritis, it begins to deteriorate, it begins to break down, you know, and so your bones started getting closer, closer, closer together, and at some point, you know, the joint, the two bones will make contact, and that's really what it's painful, very painful. Yeah.
So if you have, like in my case, 2 hip replacements and 2 shoulder replacements, would you go to an orthopedic to have it rechecked or a rheumatologist?
To the orthopedic in that
The
case.
orthopedic.
Yeah, the
Okay.
orthopedic.
Because I have diagnosed it as severe arthritis, but
Yeah. But, you know, treatment for arthritis is really, you're treating the symptoms, you know, it's no, so far no cure, you know, for it. It's some kind of condition, they think maybe it's your immune system that just breaks down as you get older, and these things begin to show up. And so, so what I'm trying to say is that, you know, you just need to kind of go a little bit deeper, you know, with the doctor. If they just say, oh, it's old age, it's old age. But you want to know exactly what is causing this. So, so that's one thing that you...
I think what happens is, I think we forget we're paying the doctor.
Yeah.
You know, it's like he's doing us a favor, or she's doing us a favor.
Yeah.
We're paying.
Yeah, yeah.
I think we forget that.
Yeah, it's a good
So
point.
if you
It's a good
have one
point.
that stinks, find another one.
Yeah, it's just like you go and buy a dress, you know, you want the dress to look okay and to be good, you're paying for that.
Yep.
Margarita, I had a fracture when I was about 35. I stepped in a little hole that my boys were digging, and I fractured the ankle. And I think if you've had a fracture early in your life, like in your 30s or 40s, I think that's a good spot where arthritis starts to set in, because I noticed I've got a little discomfort in that ankle. And the podiatrist said, well, it's probably a little arthritis setting in that old fracture. So that's another thing
Yeah,
that
this,
can happen.
to diagnose arthritis, you know, probably the first thing they do is to send you for an x-ray, just to see there's enough space between your bones, you know. It doesn't look at soft tissue, you know, the x-ray doesn't look at soft tissues as much. So the doctor might order extra tests to see, you know, a blood work to see what's going on in that inflammation. It's like mine, in my case, they rule out that it was Lyme because it was a new infection. It would have shown up in my fluid. All right. So so I did a little searching, and you know, if it's a new infection, I was concerned because if it's a new infection, that I didn't think it was because I didn't think I was exposed. But if it was a new infection, then I should have been treated with antibiotics right away, right? So that's what I wanted to kind of just make sure that it wasn't. And so I said to him, how about antibiotics? And he didn't really explain to me that, which I'm a little upset. He didn't explain to me the difference between Lyme disease showing up as a chronic condition in your blood work, you know, different than in your fluid that he took out, you know, my synovial fluid that he took out. He just said to me, it's just old age arthritis. So I went home, and then I thought a little bit more about it, and so I talked to my doctor, my medical doctor, and she got the report from my blood work, and in the blood work, there's a line that shows your, and I don't understand these terms, maybe you understand that, an IgM and an IgG. So one is it takes all Lyme, and the other one that takes new Lyme. So, you know, and mine, so my medical doctor explained to me that whichever those three letters are, that in the case that you have Lyme, it was not in my fluid. It was in my blood work. So that showed that it was a no. So, you know, it's just that they don't tell you enough. They don't want to explain too much because they think, oh, they don't know anything about it.
Or they don't take the time too.
They don't take the time, so that, you know, that's kind of, you know, you want to find out if you're not satisfied with what the doctor is saying, that you ask a little bit more.
Also, they don't tell
questions.
you a lot because they figure it worries you. You don't understand it well, so it worries you. I know I questioned my doctor about some things, and I said, why didn't you tell me that before? He said, I didn't want you to worry about it.
Yes.
You know, it's nothing that can be.
Yeah. I think that if they cannot treat it with something that cannot be treated beyond what they're doing, they don't want to bother telling you,
Yeah.
explaining to you. If it's something that needs to be treated, then they will
Yeah.
they will order some medications
Yeah.
that would,
Sadly, the insurance companies have too much input on what the doctor does for the patient.
yeah.
What we say that we're gonna, we get that, okay, yeah.
Right?
So, if you have your doctor for a long time, you feel more confident about asking the questions. But I have a follow-up appointment with him, and I'm going to ask him then, why didn't you explain to me? I talked to my medical doctor, and my medical doctor really looked at the lab work, and explained to me. So I really like to know, I like to know what's going on and what's happening. So that's kind of important. The other thing is that always ask for your lab report, the lab report, a copy of your lab report, and then make sure that your doctor sends it to your medical doctor, CPC, and so if it's something that you don't understand, you ask the questions. If you go and get your bone density test, the report from the bone density test, it tells you, the numbers on what is your T-score, this and this. And then at the bottom it says, this means normal is this, yours is, at this level. You have osteopenia. And so it says that at the bottom of that test. So it's good to have it, and if you go to the same place to have your bone density test, it will show previous, your history of your bone density, and you can see how it's either progressing, it's staying the same, improving, and whatnot. So it's just good to have that record, and then you can take it with you if you move, like in my case, and I'm probably going to be changing doctors eventually. I love my medical doctor, and I think it'll be hard for me to find a doctor that she knows me forever, and she's just great. It's important to have like a folder with all your medical records on hand in case anything happens. So that's what I wanted to talk to you about today, and see if you do have an appointment with the doctor in the future. Just write down those questions that you want to ask, and make sure that you understand before you leave. And it also says, if you have a main concern that you have, ask that at the beginning of the conversation, and not at the end when you're just kind of leaving and just asking the doctor all of a sudden, say, oh, I forgot, okay, to ask these questions, and the doctor's going to be rushing to see the next patient. So your main concern, bring it up at the beginning of your visit. just as you're coming into to see the doctor at the beginning of your visit. Just to say, this is my main concern, you know. Can you address that?
Steno pads. Steno pads are not just for stenographers.
Okay?
Good.
Yeah.
Thank you.
All right, you're welcome.